This video will explain what FODMAPs are and how to follow a low FODMAP diet. The video will also briefly explain what a hydrogen breath test is. What are FODMAPs? FODMAP stands for fermentable oligo-di-monosaccharides and polyols. FODMAPs are carbohydrates, also known as sugars, that are naturally found in foods. FODMAPs are an important source of energy for the body. There are many high FODMAP foods, such as honey, garlic, and avocados. Later in this video, we will discuss other high FODMAP foods. FODMAPs in the diet. There are 5 types of carbohydrates or sugars that are considered FODMAPs. Fructose is a carbohydrate found in fruit, honey, and high fructose corn syrup. Lactose is also known as milk sugar and found in dairy products. Fructans are carbohydrates found in wheat, garlic, and onions. Galactans are commonly found in beans and lentils. Polyols are also known as sugar alcohols such as sorbitol, xylitol, and mannitol. Stone fruits such as avocados, apricots, cherries, peaches, plums, and nectarines also contain polyols. Can everyone tolerate FODMAPs? The answer is no. Not everyone can tolerate these types of sugars. While some people are able to consume FODMAPs without experiencing any gastrointestinal side effects, many people with digestive disorders such as irritable bowel syndrome, also known as IBS, find that FODMAP foods trigger symptoms of abdominal pain, gas, burping, bloating, constipation, and/or diarrhea. This is because these sugars are poorly absorbed and they're rapidly fermented or digested by the naturally occurring gut bacteria, leading to gas and discomfort. What are FODMAP foods? FODMAPs are in a wide variety of everyday foods, including fruits, vegetables, legumes, milk products, and sweetening agents. Each person has an individual threshold for tolerating FODMAPs, and some foods may pose more of a problem than others. So what are high and low FODMAP foods? As you can see from this list, there's a long list of high and low foods that are allowed and that you should avoid. The focus is to replace the high FODMAP foods with low FODMAP food choices in order to maintain a nutritious and well-balanced diet. These foods provide an incomplete list of all of the high and low FODMAP foods. Additional resources will be provided that will show a complete list of all of the high and low FODMAP foods. Following a low FODMAP diet. For people who experience unpleasant symptoms by eating high FODMAP foods, it is recommended that a low FODMAP diet be implemented in order to reduce gastrointestinal distress. But you do not have to eliminate these high FODMAP foods forever. It is recommended that high FODMAP foods be eliminated for a period of time, and after that period, one FODMAP food can be incorporated. For example, you can incorporate foods from the fructose category first, and then if no symptoms occur, moving on to another group, such as the lactose category. This can help you identify what foods trigger symptoms. This slide provides menu ideas for breakfast, lunch, and dinner, and all of these menu ideas are low FODMAP choices. Researchers in Australia aim to study if a diet low in FODMAP is an effective way to manage gastrointestinal symptoms in patients with digestive disorders, in this case, IBS. VAS on this graph stands for Visual Analog Scale. It was a scale the researchers used to measure symptoms experienced by the participants. 0 means no symptoms, and 100 means the worst symptoms possible. The graph demonstrates that people who were given a low FODMAP diet in comparison to a normal diet experienced significantly less bloating after 21 days, and results were seen after 1 day. Similar results were seen in abdominal pain, as well as the passage of wind, or gas. Approximately 70% of participants had overall improvement in symptoms. Therefore, researchers concluded that the low FODMAP diet is efficacious for the treatment of gastrointestinal symptoms related to irritable bowel syndrome, or also known as IBS. The low FODMAP diet is not a lifelong diet. You do not have to restrict these high FODMAP foods forever. There is good news. There is an additional test that can help identify intolerances to 3 major FODMAPs: lactose, fructose, and fructans. What is the hydrogen breath test? The hydrogen breath test provides the healthcare team information about the digestion of carbohydrates or sugar. The test can also detect abnormal growth of bacteria within the small intestine, which can also cause gastrointestinal symptoms. How does the test work? Bacteria in our intestines digest carbohydrates and convert some of the sugars into gases, most commonly hydrogen. We measure the hydrogen in your breath, and based on these levels, we can determine if you have an intolerance to a specific sugar, such as lactose or fructose. If the healthcare team is testing for a sugar intolerance, such as lactose intolerance or fructan intolerance, the test takes approximately 3 hours. If the healthcare team is trying to figure out if there's abnormal growth of bacteria in the small intestine, this test takes approximately 90 minutes. Why should I take this breath test? The breath test is simple and quick, and it's a way to liberalize your diet, rather than restricting all of the high FODMAP foods. You can take multiple breath tests over a period of time. Tips for following a low FODMAP diet. Following a low FODMAP diet can be tricky at first. Some tips and tricks are as follows. 1. Read food labels and avoid foods made with wheat, honey, high fructose corn syrup, and soy. 2. Buy gluten-free grains, as they do not contain wheat, barley, or rye. But you do not need to follow a strict gluten-free diet, as the focus is to limit high FODMAP foods and not gluten. 3. Limit serving sizes of low FODMAP foods, such as fruits and vegetables, if you have symptoms after eating these foods. These symptoms could be related to eating large amounts of low FODMAP foods at a time. The serving sizes of these foods should be limited to 1/2 cup. 4. Include fiber-rich, low FODMAP foods, such as oatmeal, as constipation is common. Drinking water can also help prevent constipation. And finally, keep a food log. Keeping a food log can help identify trigger foods. In addition to keeping a food log, using a FODMAP app such as the Monash University Low FODMAP Diet app can be extraordinarily helpful when managing this diet. The food guide section of the app lists 8 major food groups with over 700 different serving sizes. The recipe section contains over 79 meal and snack ideas that are all low FODMAP. The editing journal section allows you to record any gastrointestinal symptoms according to the severity. This can help you keep track of trigger foods. These are just a few of the many resources that the app offers.